So I'm Mike Northey. I'm one of the GPs that helped set up the face-to-face assessment centre, and this was just a quick video to, I say quick, it'll be a few minutes, just to run through how it runs and where things are for people who haven't worked here before. So this is the Woolston site, and we'll do a little mini tour now in a second. We have been running for a few months now, and there's been some slight changes that are going to kick in as of the beginning of August, and there's going to be, it's going to be run by one GP, one AMP, and there should be an admin and staff here every session. The idea is that any practice in Warrington that has patients who have suspected or confirmed COVID, who need face-to-face assessments for whatever reason, can send the patient here for that assessment. So that might be because they've got worsening breathlessness but are not quite ill enough to necessarily need to go to A&E. Then they could come here to make sure, get an assessment, make sure things are safe. Or they might have COVID and another problem such as abdominal pain that we think needs examining, rather than just either carting off to A&E or reassuring over the phone. So yeah, that's the kind of patient that we'd expect to be seeing here. When we come in, the idea is you'll be logging it in, and this is going to be where the computers are kept at this end of the surgery. The login, the idea is that we're going to run, because we've got System 1 practices and EMIS practices. So most practices are System 1. The host site is Padgate Medical Centre, and they run a System 1 service, and so the surgeries that practices are booking into are going to be on System 1 and under Padgate. So coming in, we're going to want to log in to Padgate on System 1, and that way we'll be able to see the surgeries as the triage slots are being booked into. So the logic is that when patients are being booked in, they are being told by the practices that a clinician will give them a call back, and not telling them to come directly down to the site. So the idea is that on those triage slots, the clinician will obviously give the patient a call, run through the symptoms just to make sure that we're happy with what's coming in, and we will then give them directions how to get here. And this is at Woolston Leisure Centre. It's if you tell them to aim for the car park here, and then there'll be a number to give them to call for when they arrive. The number will be here for you to call, and so it's a mobile number that they will call to let you know that they've arrived, and then you can go out and assess them as need be. So it'll be the Padgate System 1 system open. The idea is we will also, anyone that's working here should have the access to all the surgeries across the town. So the idea is you can then open up another System 1, you can open up a second version of System 1 and log into that practice. So you can then log into that surgery and see the patient, read the notes, input data, prescribe from the system, if you like. There will be some EMIS practices, and so for those practices it would be a case of needing the individual identification reference for that practice, putting that in and being able to then access EMIS. And again, we're in that system and we are inputting data live onto that system. So yes, that is the getting patients, that is the accessing the records, and that is then the how to influence those records. Then when it comes to the actual logistics of when someone arrives, so someone calls to say that they're here and they're ready to be seen, then in that case we will need to go and get our things on. So down the corridor there's 3 clinical rooms. In the storeroom we have our PPE. And so there will be all the things that are in here, so masks, obviously gowns, gloves, all the usual things. There's also backup tanks for oxygen if that were needed. Though if we need them, dipsticks for urine testing, although we've not needed to do very much of that. But other kit is in here. We get together the relevant kit and take it through into So this is room 3. This is the clinical room closest to the door. We have our PPE in here. We also have the boxes with clinical kit to take to the car side. So the logic is that in most circumstances we'll want to be assessing the patients at the car side. We don't want to bring anyone into the surgery that doesn't need to. Again, if we will be going to the car side with a kit, we're advising patients to be wearing face masks when they're coming down. You might want to take a spare one with them in case they've not got a face mask. I want them to be wearing one while you're assessing them. That's not our policy. We don't be giving everyone a face mask, but just to be on the safe side. I'd also take out there will be some of the orange bin bags for waste to take with you so that you can put any kit directly into those orange bin bags as you need to. At the car side assessments, for patients that are coming in and we're just wondering how breathless they are, of course the asymptomatic hypoxic patients are the ones that we might want to watch out for. So as you might well have already been doing, to assess those patients, it's getting the 40-step challenge. So the idea is to get them to get out of the vehicle, walk for 20 steps down the side of the building outside, you'll be able to see that there, and 20 steps back towards us, checking their SATs at that point and seeing what happens. And if those SATs are dropping below 94%, then our policy is that we recommend they probably need to be assessed in A&E. If they are dropping significantly more than 3%, again, we need to be considering that that person needs to be seen in A&E. So we're hoping a lot of assessments can be carried out at the car side. For the patients that need to be seen in the surgery, that need a physical examination, we bring them into the surgery, keeping appropriate distance, guide them into the clinical room nearest to the door. So if this room was in use, then we guide them to the next door along. Obviously we bring them in, do whatever physical examination we need to do, and we would then, depending on the situation, if they needed oxygen and help, and if we need to call for an ambulance, then we would do that. I'll show you the crash tool in just a second. Equally, if we're examining the patient, we're happy we know what's going on now, we can send them on back out towards the vehicle, and we, as much as we've donned our PPE, all the instructions to do so is on the wall if we need it. We would doff in here as well, stick all the stuff in the orange bag, get rid of it, and then yeah, we would then go back down towards the admin area to write into the clinical record and prescribe if we needed to. If we need to, we can feed back to individual surgeries. So say if we decided actually we think this person might need, I don't know, a chest x-ray, or we feel that, or there's a bit of problem with the prescribing and we can't quite get a prescription there. If there's something that needs to be sorted, we can task the individual surgery where the patient is registered. The way we've been doing that is we've been marking it as an urgent task with whatever clinical details need to be there, and we've been assigning that task to the groups that you can send tasks to. Every System 1 surgery should have an unassigned category. We would send it to the unassigned group, that task, and we would then follow that up with a phone call to the surgery just to let them know that there's a follow-up that needs to happen with that clinician, with that patient. So yeah, so we've seen the patient, we're coming back right up the record as best we need and do any prescribing, and then move on to the next patient would be the logic. In the room 1, the third room away from the door, there's the resus trolley with oxygen in it if we need it, and yes, as I said, the spare oxygen canisters down in the storeroom, and I think that is most of how we run. If there are any problems, then we'll keep, obviously most people there'll be at least one person here who worked here before, who we can discuss things with. If there's an admin issue, then there are numbers that there's a file that we keep in in this admin area with the numbers for Andrea Catterall from over at Padgate, Lorraine Stratolis, who's a practice manager who's also been involved in setting up the service. My number's in there as well, so if there are problems you can always call somebody, but I'll make sure Raki's number in there as well, Dr. Raki Raj. so that you've got, if there are numbers that, if there's someone you need to speak to, there's ways of getting hold of people. But hopefully, like I said, there will be someone here to greet you at the beginning of the session, from an admin perspective, and they'll be able to run through the basics again. But yeah, hopefully that's how we run. So thanks very much, all the best, and thank you.